He. I am Dr. Jimmy Matthew. I am actually a professor in one of the medical universities in Kerala. But I write a lot. I'm interested in a lot of other things. I have a degree in psychology, and in addition to my postdoctoral medical degrees too. And I started this channel with the express purpose of communicating science to the public, but not later it became not only science, history, pure speculation about the future, or other social issues. And because I have a degree in psychology too, I was keenly interested in human nature, and a lot of our social issues are connected to that. And I became interested in that too. How we analyze information, how we assimilate information, and how we act on that, and how we as a society are influenced by that. But most of my videos till now have been in Malayalam because I thought that most of my audience is from Kerala, and it would be useful to speak in that language. And there are so many channels in English, you see, who can speak better English in a much more fluent manner. So I was not sure whether another channel which talks the same things in English will attract or will be acceptable to the viewers. But I thought that I had a niche audience with the Malayalis and from Kerala. But I was thinking whether you would be interested in hearing my thoughts in English too. Not so good English, but I'll try my best to be so articulate in that. My English is good when I write, but may not be that good when I speak. So you can comment, you can please tell me in the comments. So it depends on your comments and what you want, whether I'll continue these things in English. So I was thinking I was putting out one or two videos maybe in a week, one video in a week or two videos in a week. But if you are interested, whenever I put a Malayalam video, maybe in that same topic, I'll talk in English, not the exact translation, but something, almost that same topic in English. If you want it, please subscribe and please share and please comment that how you would want English videos and why you would want it. And please comment, especially if you are watching this and you are not a Malayali and somebody who doesn't know Malayalam. So that's what I am looking for. Are there enough viewers in that category to justify me speaking in English too? So today, in the first video, what I would like to talk about is why any medicine might work. Okay, medicine is an old science, or actually an old practice. It's not science; it's an old practice. Whenever human beings have been there for many years, maybe lakhs of years, 200,000, 300,000 years back, we were there, almost modern humans. But since that time, whenever one of our fellow human being is in distress, is in disease, has got a disease, humans have tried to heal them. So in any household, you can see people knowing some medicines. It's enough to give them some garlic. We can give some ginger and hot water and sugar to treat a common cold, things like that. But and it might work also. Okay, what I am talking about is evidence based medicine and why we need scientific evidence to evaluate medical treatments. And I am talking about why any medicine might actually work in the real world. You just imagine that you have a cold. Okay, and the second day of the cold, you become increasingly agitated, your nose is all blocked, you are coughing, you are febrile, you have fever, high fever which is not abating. Even by the third day, you become panicked, and you are you panic, and then you go to the doctor and you just insist that, please doctor, I want antibiotics. And the doctor, sometimes doctors do prescribe antibiotics in this situation, sometimes they don't. But whatever it is, you become better from the fourth or fifth day onwards. And naturally, you might attribute it to the antibiotic. But it may not actually be indicated, and you might be getting healed by a natural process, because most colds don't last more than 5 or 6 days, maximum a week. So you may come out with the notion that antibiotics are very effective in colds, for me at least, when most colds we know are viral, and antibiotics are not needed. Okay, they don't do only harm. But suppose you go to a homeopath, or you go to an alternative medicine specialist, or somebody tells you, okay, you just take some honey with some this thing, just try it, just some honey with some lemon. And some people would say, okay, some pepper with some brandy. And you try that, again you become better. Then you would become a strong advocate for brandy with pepper. That can happen. What has happened here is that this is a self-limiting disease, basically, in most people. Okay. So anything would cure it, and you would attribute your cure to that. So that is one way how that can happen. Second way is the placebo effect. But that is why we give the trial, we say that it usually has to be placebo controlled. Okay, so whenever we gave gave a trial of the COVID vaccine, we give the vaccine and then we give some saline or similar thing which is not effective to one group of people. So as for 1,000 people you give the COVID vaccine, then for 1,000 people you give the saline water, and then you follow them up for maybe 3-4 months and see how many develop COVID, and then see whether there is a difference. Why? Because any treatment can have an effect. This is called the placebo effect. So it can be psychological. It can even be otherwise. We don't know the exact reason for that. But usually the effect is mild. But the frank truth is that if you have a disease, even if you have significant distress, some aspect of it may actually be cured by anything. A person giving you an explanation, an authoritative person, and maybe your grandmother will tells you, hey, beta, this is like this. Son, this is like this. This is due to your vata becoming this. This is because your toxins are building up in your body. And I will give you a honey and ginger tea which will wash out the toxin. So she has given you an explanation. She has assured you that it will work. And then when you take it, you feel you feel good. A lot of your symptoms are gone. And this is the placebo effect. Of course, and it can have an effect more than psychological also. And the way I have put it looks as if it is all psychological. May not be, because studies have done where gastric ulcer healing has been studied, and they have found that sugar pills do act to an extent, but the effect is usually small. But what we need to understand is that any treatment can have an effect due to a psychological or an unknown reason. So we can have an effect when the disease is self-limiting. You can have an effect when the effect is just a placebo effect. Okay, it is usually not a very big effect, and usually it may give a false assurance also when you have a serious disease like heart disease or cancer, and your symptoms may abate, but the disease process may continue. Next in the line of reasons why any medicine can work, something called regression to the mean in chronic diseases which have got a remitting and exacerbating course. Remissions and exacerbations are known in many diseases. Okay, remission is when you have the disease, but it is at a very quiescent stage and you don't notice it at all. Say like rheumatoid arthritis or some asthma or some psoriasis, diseases like psoriasis, it suddenly flares up and you are very distressed by the disease. Okay, but there are long periods when you are completely disease free, and when the disease is very troubling you so much and the symptoms are very bad, then you go to the doctor. So whatever he gives is slowly over a course of time, it comes back to the usual or the quiescent stage. Okay, but this is not such a good thing, because in cases like asthma you have a solution, that inhaled medications might permanently decrease your bronchial hyperreactivity, so that your hyperreactive response is near permanently curtailed. It has got a permanent effect, and you may not get as much exacerbations in the future in a really effective modern medicine remedy. While this is given a free run in any of these disease, in these treatments in which it may not work properly. Okay, so that is one thing. In rheumatoid arthritis, a thing which gives you a sham treatment, which gives you this kind of benefit because it just follows the course of the illness. You may have severe sequelae of the rheumatoid arthritis, like joint deformities, persistent pain, persistent inability to flex the joints or use the joints, while timely effective treatment can minimize these deformities. So it is not always a good thing to leave a remitting and exacerbating disease to run its course. But you will be convinced that the treatment works. Then the last thing is serendipity or chance, which miraculously leaves some people to have a delayed effect of a very serious disease. I'm talking about a study which came in around 2006, 2005, 2006, where Australian oncologists studied around 2,300 people, more than 2,300 people who had terminal cancer, and they were assigned to palliative care. Okay, you imagine 2,300 people who have been diagnosed with terminal cancer, very advanced stage, who will not benefit from treatment which is curative, and you tell them, okay, you will be given only pain and palliative care, okay, and you are likely to die. So enjoy your time, and we will do everything possible to treat your symptoms. So that's what they have been essentially told. But when they followed them up as predicted, they found that on an average, most people died. On an average, the average survival was only 5 months. So most of them died within 5 months, a window of 5 months. But they found that 1% lived more than 5 years. 5 years. So 5 years is a standard time when they are followed up. So after 5 years, we don't know. Some might have lived even longer, maybe 10 years, 15 years. We don't know. But what I am saying is that even in such a cohort, human beings are very complex. Diseases are very complex. Biology is a very complex subject. We really don't know what is happening. For some people, 1% of 2,300 comes to 23. And cancer is one of the commonest causes of death after cardiovascular disease and stroke. That means that there will be thousands of people who have been diagnosed with terminal cancer, but who live a long time, miraculously. For them, it is a miracle. So whatever treatment they have taken at that point of time, any alternative treatment, prayer, whatever, will seem to be miraculously effective for that particular person. I am not saying miraculous cures cannot happen, but it is very difficult to tease out these things. Are they chance events? Things like that. So that is why we need evidence-based medicine to know whether it's actually effective, or actually effective than the best treatment possible, or actually effective than a placebo or not treatment at all. Okay, so I'll just please comment if you want English videos. Otherwise, I will not continue that. And please share and subscribe.